Okay. Hi guys. So my name is Brittany, and I have been a nurse now for a year. I started off working in a hospital as a student nurse for 1 year, and then I transitioned to that RN position. And before I went into nursing, I was looking at different videos, seeing if nurses had any advice or anything like that. And I specifically work on a telemetry unit. So I'm basically just going to give you a breakdown of what it's like to be an RN on a telemetry unit, at least like an example of how your day could potentially go. In the morning, I just kind of make sure I have all my supplies, make sure I have my badge, make sure that I have my clipboard. It's like a nursing clipboard and it has a few labs and like additional notes on it. But I have my clipboard, I have my, I guess it's called like a nursing brain, which basically has like this blank, well, it's not a blank sheet, but it's this sheet where you can basically fill in information for a head to toe. So when you're receiving a report, that's what you're using. So I make sure I have that I have my stethoscope, that I have my pen light. I usually have like 2 to 3 black pens with me just in case one runs out of ink. I usually have 1 to 2 red pens if I'm making notes for something in particular. I usually have at least 2 highlighters, an orange highlighter and a yellow highlighter. And then once I get to work, making sure I have everything that I need, usually tape, right? Tape that's a bit more sturdy, and then one that's a bit, sorry for right there, and one that's a bit softer on the skin. So I go in there, make sure I have all my supplies ready, and then I clock in. So then first things first, right, you clock in and then you start receiving a report on all of your patients. So what's happening is that the nurse from whatever shift was prior. So like say if I'm on the day shift, right, I'm receiving a report from the night shift nurses. So she'll basically, right, we'll go into the patient's room, we'll open up the computer and she'll kind of show me basically any active orders, anything that's pending that I need to complete also, reviewing anything important, any important labs, any medications that may stick out. So we're basically reviewing anything like that. So she's giving me a report, right? Like basically a head to toe on the patient, anything that's really important. And then of course, as I'm going in there, I'm introducing myself saying, hi, my name is Brittany. I'm going to be your nurse for the day. And just introducing myself and then getting that report. So we're going into the patient's room one by one. Sometimes you'll have report that needs to be received from multiple nurses. So then you'll just wait until that nurse is ready to give you a report. And in the meantime, if I'm waiting, I also try to go to the computers myself and see what I'm able to look up and try to get organized. So not only do I have that sheet that I'm filling out that has the basic information from the head to toe, vaccines, code status, allergies, anything like that, but I also have a separate sheet that's just blank that I fold up, and that's where I leave space for like my vitals, and what else? Oh, and my meds, so that for sure I know when I'm going back into the room, because meds can basically be given at any time, at any hour. So yeah, I receive report, and then once I receive report on all my patients, that's when I'm jumping into the rooms, introducing myself again, and then getting vitals and doing my head to toe. So I'm doing that, asking questions. Hi, like, may I have your first and last name, your date of birth? Can you tell me where you're at, why you're here, all of that, so that getting their vitals and already starting at that head to toe. So those are neuro questions. So after I get all I need, I'm trying to document as much as I can. And if I feel like I'm taking a bit too long, I just try to be aware of that and try to kind of watch my pace. But I try to document as much as I can and then move on to the next patient. So that's the first things first, vitals, head to toe, documenting, and then going around and giving medications. So after medications, say if it's between 8 and 9, just doing any charting that I need to. And then for me, since I'm on a telemetry unit, we have to call in the tele boxes. And so what I basically do is I look at all my patients, right? And I'll call the people on the monitors and just let them know, hi, this is Brittany. I have patient so-and-so. Give them more information about that and say, okay, they have tally box number XYZ, and this is their normal heart rhythm, so that they'll be able to notify me if they see any changes throughout the day that seem really odd. And yeah, they'll just call me to let me know so that I can go and check up on the patient, say if I'm not in the room at that exact moment. So I'm making sure that I'm doing that. And then around 10 o'clock, at least at my hospital, we'll do a group huddle. So at a group huddle, we'll basically share any updates, like any important information that we have to know. My staff is really on it and they'll be very helpful. You get to basically discuss, okay, like, is there anything important that you really have to look out for? Does your patient have any central lines? Any catheters, any skin issues, any unusual procedures? That way we can all kind of be aware of what's going on and help each other if the need be. So we'll basically do that, and then after huddle, I'll meet up with the case manager. So afterwards, right, meeting up with the case manager, just letting her know if there's any updates that I'm aware of just yet. And so that we could kind of come up with a plan and just make sure that we have everything set before that patient discharges. So I'll meet up with her or him, and I'll just give them basic updates. And then after that, also, it kind of depends when the doctors come. They can come before, they could come after. Sometimes they'll come later in the day. Different doctors, right? Different consults. And I'll receive updates from them. And then from there, I can also speak with the case managers and update them with any updates that I have myself. I said that word a lot. But yeah, I'll basically, right, let them know what's going on, receive those major updates with the doctor as they're doing rounds, anything important that I took note of as I was there during the day shift. If the night shift nurse told me something that was super important that I had to relate to the doctors, then I'll go ahead and let them know. Anything important, any labs that seemed really off, potassium seemed a bit off, or anything like that. I'm basically just updating them just in case. So then after that, basically you're checking up on your patient, at least, right? Like for me, it's every 2 hours, you're at least just kind of checking up, just making sure they're okay, doing safety checks, checking IV. If your patient has to be repositioned, if they're not able to reposition themselves on their own, I'm going in there and assisting them. If I need assistance from a CNA, I'll just ask for their help as well. And then in between, if they need anything else, just kind of keeping an eye out for anything really important. At other moments, right, also just asking if they're in any pain. Throughout the shift, making sure that you're doing, depending on where you're at in the hospital, doing your reassessments, and then especially like if your hospital really focuses, right, on like at least completing those focused assessments. So say they came in there for like some kind of infection on their foot, right? So you did your whole head to toe in the morning, but then later on in the shift, right, you're making sure that specifically is looked at, taken care of. Okay, they're in here for an infection in their foot, you know, so you kind of just making sure that everything is still set. So you're in the patient's room quite often. It's very busy, very, very busy. You're on your feet a lot. It is not boring. Those, like, I have a 12-hour shift, and it keeps you very, very busy. But yeah, basically, like if your patient's a diabetic, you're going in there around lunchtime, around dinner time again, checking blood sugars, seeing if you need to cover them for insulin, making sure that they're eating okay. For my hospital, it's around 1 o'clock where we do something called an evalysis. So basically, it's just like you're documenting the level of care that you're providing for them. So like their acuity. So say if they require not as much care, then you're documenting that. If they require a bit more, you're documenting that. And you're inputting that into the system so that whatever shift is occurring next, they'll know how to like delegate which patients to which nurse to kind of give them like a balanced patient care. I don't know how would I say that? Like a balanced assignment. There we go. Trying to give them more of like a balanced assignment. So maybe some patients that require a bit more care and some that don't require as much. So I'm making sure I'm doing that. When I have free time, of course, they like to encourage us to educate the patient because, of course, you're always providing education upon when they're discharging. But sometimes that may be quite a lot for them, quite a bit of information all at once. So for us, right, we try to provide education, say even like the day before, the day after, so that they're just kind of constantly being told like, okay, how can I care for myself in this situation and everything like that. So those are a few things. Of course, since I'm on the telemetry unit, I receive my EKG strips for 8 o'clock, 12 o'clock, and around 4 o'clock. So I'll at least have those. If they're admitted at an odd time, I'll receive EKG reports for that specific time. But usually at least that's the routine thing, and then just kind of marking out my own notes on that sheet. And so those are a few basics. And then of course throughout the day you'll get admissions. So for us during an admission, we receive a report, we get our vitals, we get our head to toe, and then we fill out an adult patient profile, which is just a bunch of basic health questions about, do they have a medication pump, medication patch, what does their health history look like, and all of that. And then if we have somebody that's discharging, we provide them with a bunch of sheets. So a medication list, like a discharge planning sheet, any follow-up appointments that they have to look out for. I'm providing them with teaching on their condition, on their medications, anything like that, any vaccines that need to be administered. I'm providing education for that and then actually giving it to them. And what else? Yeah, that's kind of it. Just making sure I'm doing an assessment again, making sure that they're really set to go home, and then taking off whatever needs to be taken off, telemonitor any IVs, and then making sure they have all of their items and that they're set to go. So yeah, that's basically my day. It's quite busy. Medications throughout the day, reassessments if people need other things. I'm helping them do that. But yeah, that's like my day as a telemetry nurse.